welcome to SVG-TV News for Tuesday, March 16, 2021. I am Rochelle Batiste with the details. Minister of Finance Camilo Gonzalez, in a ministerial statement today in Parliament, said that government revenues continue to decline, noting that current revenue is 3% lower when compared to the corresponding period last year, which is as a result of the effects of the COVID-19 pandemic. The finance minister reported that a number of sectors have all seen a decline. However, due to the sale of properties, a government received a boost in revenues.
A 2.4% decline in revenue from taxes on income and profits, a 14.3% reduction in receipts from value-added tax, a 47.3% fall in revenue from excise duty on imports, and a 10.6% decline in revenue from import duties. Fortunately, Madam Speaker, a few large property transactions generated atypical revenues from alien landholding licenses and stamp duty, which together exceeded the 2020 totals for the corresponding period by a total of $8.7 million.
Minister Gonzalez said that the country is, however, doing better than expected, as was projected at the start of the year.
In sum, given the precipitous decline in January 2021 revenues, our fiscal situation after the first 2 months of the year is marginally better than forecast. Interestingly, although total revenue and grants are down slightly relative to 2020, this year's total is still 5.5% higher than the corresponding period in 2019 and 17.1% higher than that of 2018.
The National Insurance Services, the NIS, will no longer be able to pay the unemployment benefit to persons laid off due to the pandemic. This was announced in Parliament today by Minister of Finance Camilo Gonzalez, who said that government has extended the unemployment benefit to June and will solely be responsible for payments.
However, the NIS no longer has the flexibility to continue funding its portion of the initiative within the scope of its own prudential guidelines. As such, for the upcoming quarter, the government will bear the full cost of the intervention. So, for the past 12 months, it was split between government and NIS resources, government and NIS resources, and going forward this quarter, the government will bear the full cost of the intervention.
Initially, the NIS was to pay the benefits for 3 months, but ended up doing so for 1 year. The finance minister said that to date, more than 9 million EC dollars were paid out by the NIS during this period to more than 8,000 Vincentians. The Ministry of Education has requested that teachers return to school for 3 days starting tomorrow, Wednesday, March 17th, for professional development purposes and consultation on the evolving protocols for the reopening of schools, slated for April 12th. This has been met with opposition by teachers due to safety concerns. On Sunday, March 14th, National Heroes Day, the SVG Teachers Union, the SVGTU, held an emergency meeting with members where it was agreed and decided that the 3-day session can either be held virtually or deferred to a later date. At a news conference today, President of the SVGTU, Oswald Robinson, said that it is the view of teachers that the 3 days can be used to finish the lessons being taught online with students, while also pointing out that asking teachers to return to school will flout the indoor gathering protocol.
You're telling the church is 1/3 of the population, but you're asking schools which are already mass gathering to come back in full. So we want the authorities to go back to the drawing board and acknowledge the error, serious error, breach of the protocol, the very protocol, and let us do things properly. You know? So when you hear anybody calling you to say come back to school, remind them that you made that decision in a duly constituted meeting. And the decision has been carried and now the executive has the responsibility to execute it. And that is what we're doing.
As it regards to the reopening of schools on April 12th, First Vice President of the SVG-TU, Vanrick Williams, noted that teachers are willing to return to their classroom, but there are still too many unanswered questions when it comes to their safety and that of their students. He said that they were in dialogue with the Ministry of Education, but the authorities went ahead and made a decision without completing the discussion.
Saying, if you are making decisions, include the educators, not the educators who have an obligation to someone or who have a biased opinion, but educators from all around, so we can have a balanced opinion and that we can make suggestions that everyone can be comfortable with. We are here today to echo the sentiments of our general membership and to clear the misinterpretation, the misconception that teachers do not want to return to school. That is not so.
Lawyer representing the union, Zita Banwell, said that teachers have the full backing of the law, which ensures that their rights are not trampled upon.
The public, in terms of the government or private space, as in a private employer, is basic. You must be able to provide an adequate and safe workplace. And in the context of coronavirus, the teachers are asking that the government provide satisfactory, adequate safe workspace. You've mentioned the issue of the basic protocols.
The SVGTU said that they will be conducting their own inspections and monitoring of the readiness of schools for reopening on April 12th. And Prime Minister Dr. Ralph Gonsalves spoke on the reasons for teachers returning to school tomorrow, Wednesday, March 17, 2021, for what the Ministry of Education has deemed as professional development for the next 3 days. Speaking on the radio on Sunday, PM Gonsalves hinted at teachers being given the opportunity to take the vaccine during this time.
The objective circumstances are propitious for an opening. In fact, if the Easter holidays were not so close by, I would have urged that the school be opened right away, because I think that you have to live well with COVID.
PM Gonsalves admitted that he would have liked to see school reopen earlier than April 12th, citing the 5% positivity rate for COVID-19 and the ongoing vaccination exercise in the country.
They're asking for the teachers to come in on Wednesday so that we can, those teachers who have taken the vaccine already, would bring their cards and become advocates for the taking of the vaccine, and those who haven't, to be persuaded to take the vaccine, and also an opportunity right there to take it then and there.
And Prime Minister Gonsalves said that in the spirit of the national hero Joseph Chatelier, with good sense and solidarity, discipline and science, he is urging Vincentians to take the COVID-19 vaccines. He was speaking at the Wreath Laying ceremony in commemoration of National Heroes Day. PM Gonsalves noted that the risk of not taking the vaccine is far greater than taking the vaccine.
And there are persons who are waiting for this or that vaccine. I said the best vaccine for you for COVID is the one that is available. And the vaccine for COVID didn't start just last year for the development. The process accelerated, admittedly. It is in the spirit of Chatelier. I'm not just telling you that I took it and it's a personal decision. You can take it if you want. No, I'm going further than that. I took it, and I'm urging you to take it. And knowing what I know of Chatelier, he would have been an enlightened and scientific person today. Because for him to carry out the kinds of struggles that he carried out, he would have been an enlightened and scientific leader.
PM Gonzalez also announced that the hosting of Carnival this year depends on if 70 to 80% of the population get vaccinated.
Are we going to have Carnival? I say we will have Carnival in July. If as we come up to the month of May, that I see that we have reached a level where we can say that we have 70-80% of the above 18 population, and then maybe it may go down to 16. Because the circumstances today are different to the circumstances last year.
And on radio on Sunday, PM Gonzalez said that his government will seek to increase the passenger capacity of omnibuses once the drivers and conductors get vaccinated. This comes after omnibus operators represented by the Vaccination Transportation Association VINTAS have been urging the government to increase their capacity from 7 paying passengers to at least 14 passengers, as most operators have complained that they are unable to profitably operate under the present stipulation. The Prime Minister said a new special rule order will seek to encourage the operators and conductors to take the vaccine.
On Wednesday, Tuesday really, hoping that we can go and publish a statutory rule and order where we are tying the increase in the numbers for the minibus operators. We are tying that to the driver and certainly the conductor taking the vaccine, because that is an area where we have been advised by the medical authorities, which is one of the more challenging areas. There are others, but that's one. The difference, of course, some people may say, well, what about the nurses who are administering the vaccine and who themselves don't take the vaccine, or who are skeptical or slow on the uptake? All what we are saying is that there's a particular regulation at the moment, and we will go along with you and increase the numbers which you want to have come in the vehicle. Well, if you want that, you get vaccinated. If not, you carry the same half. In other words, you incentivize. It's not that you're taking away anybody's right, you know. If you don't want to take the incentive, well, that's fine. You carry half the passengers. Simple, straightforward.
With a number of Vincentians still hesitant about getting vaccinated, Prime Minister Gonzalez said he is not yet ready to make the vaccination mandatory.
I'm not suggesting at this moment that we go the way of Sir James to say you pass a law that the policeman can't arrest you unless you have the vaccine, and the nurses to tell them to go to a different profession. But I understand the sentiment which pushed him into that position. I want to persuade persons, because the reason why I want to persuade persons is that this is not going to be the last of the pandemic. Because of the growth in urbanization in the main cities around the world, and also because of climate change, those factors combined are going to let us have more and more of these viral pandemics.
And SVG-TV News reached out to the president of the Vaccination Transportation Association, Roy Adams, for a comment on the matter. He made it clear that the association is not in agreement with the government's intention. However, he awaits the SRO before commenting further, noting that such a law will infringe on operators' basic human rights. He spoke with several concerned omnibus operators at the Windward Bus Terminal and the bus stop outside the Peace Memorial Hall on the latest development and whether they will take the opportunity to get vaccinated. The team also spoke with other citizens on why they have or have not yet taken the vaccine. We hear more in this report.
Speaking on WeFM on Sunday, March 14th, 2021, National Heroes Day, Prime Minister Dr. Ralph Gonsalves said that his government would this week pass a law to incentivize omnibus operators to take the jab. As the government moves to motivate omnibus operators to take the COVID-19 vaccine by increasing the passenger capacity for those who take the jab, a number of operators who we spoke with today are not fazed by the offer, noting that they will not be forced into taking the vaccine.
No, not yet. I'm waiting. I have enough time to take it. Nobody has forced me to take it. When I'm ready, I'm taking it. I walk in all the time with the 8 passenger. I find.
No, I'm not going to take the vaccine. It's not safe.
Yeah, I don't want the vaccine for nothing. It might not affect you now, but later down, you might just walk in and just see limbs dropping off.
Well, a lot of the guys say they're not taking it because it's not right. You can't just force something on somebody and expect us to just abide by that. You're not going to work with the 8 either. Oh, we're home with you, stay home with you.
Members of the Vincentian public also shared their views on the government incentivizing the omnibus operators to take the COVID-19 vaccine.
It's the head of the government policy. We have to live with it. And if we don't live with it, things will never go right. They're making bad for themselves.
It's just that to try to force it down to somebody's throat. Them things should not be.
I think that is foolish because, number one, if the driver take it, the conductor take it, the passengers don't take it, what's the difference? Who is it helping exactly? Just because they want to fill the van? That doesn't make any sense. So what about the people who coming in who may have the sickness or not? Even though he take the vaccine, he will get back the virus the same way. It's not preventing him from getting the virus, as they say. It is only, helping you to fight it. I mean, that doesn't make sense. What world are we living in right now? You have rights. This is your own body. So you have to be conscious of what you're putting in it.
With the government ramping up the national vaccination drive, members of the public who have already taken the jab shared their reasons for doing so, while others say despite promises of carnival celebrations and the possibility of life returning to some normalcy, they are still not willing to be vaccinated, at least not as yet.
I suffer from asthma and things, so you can't make it with that kind of thing, man, because you don't know. I drinking alcohol, I doing business. So when I take the vaccine, it might affect my body or wherever you want to be.
I'm a cancer survivor and a sinus case, and I don't want no complication from that vaccine.
My experience was very good. I didn't have any pain or nothing, and I did feel very, very good. But I decided to go and take it because it's something I have to take if you have to travel or in case of any sickness and we want to see the corona go down.
First of all, if the vaccine was stopping you from getting the COVID, that makes a difference. If it's stopping you from spreading it when you get it, that makes a difference also. But since it's not doing either, and the next question is, if you take the vaccine, something happens to you, who is responsible for you?
No, I'm not taking it yet. But I don't have no problem taking it, but I have to do all my medical person, my personal doctor, and then if you give me okay, I take the vaccine because I want to live more longer.
I'm still thinking about it. I guess I want to know more about it and the after effect of the vaccine.
Who making the vaccine ain't taking it, and the bigger heads just faking it. So right now, we don't trust the vaccine. You understand? This is our body. If we all eat healthy and cut out all some of the imported foods, we'll be just fine in the Caribbean.
I took the vaccine because for my personal protection and taking the chocolate painful.
Vincentians across all sectors continue to express varying views on being vaccinated. Those who are for the jab have expressed full confidence in their decision, and those against it simply do not trust that the vaccine will not cause them harm at a later date. As vaccination drives continue island-wide, it is now left to be seen what methods the government will employ to increase the rate at which Vincentians are vaccinated. For SVG-TV News, I am Shafsha Speedwell-Callum.
Of the 9,000 persons here in SVG who have taken the Covishield AstraZeneca vaccine, there have been no report of blood clots. This was noted by infectious disease specialist Dr. Gerald Thompson on NBC Radio today. He was speaking about the concerns raised about the safety of the vaccine, which has been suspended in several European countries due to reports of clots in a small number of recipients. Dr. Thompson said he doesn't believe the vaccine is the reason for the blood clots, noting that blood clots and strokes are commonly experienced by persons on a daily basis, even without the vaccine, noting that the COVID-19 virus has triggered more blood clots.
I want to say this very carefully and quickly, that currently in St. Vincent and the Grenadines, we do have a lot of episodes of clotting, strokes, and so that takes place normally. matter of fact, strokes is one of the leading causes of death here in St. Vincent, people who just have strokes. And what we found is the virus itself triggers greater clotting. The virus triggers greater clotting. So it's been a bit of a surprise that some persons are now saying, as in Denmark, that there's been a few cases where they suspect that after somebody received the vaccine, a number of days after, that there was some clotting episode. Well, these things are being examined by the European Medical Commission, as well as by the World Health Organization. I think very soon we will get some response, and I'm sure it's going to indicate that there is no greater incidence of this clotting than what normally occurs in the general population.
The infectious disease specialist said SVG will continue to administer the AstraZeneca vaccine following all the protocols to ensure the safety of injections, and highlighted the process in which the vaccine is being administered to persons.
Might be of some concern to us. We try to solicit that information, but the main thing is going to be any sort of allergic reaction, especially the most severe allergies, or an anaphylactic reaction. That's what we really want to find if they've had in the past. And then we usually would proceed to check their blood pressure, their temperature, and some other vital signs, just to make sure that they're stable. And most of these things are not usually a problem. Only if their blood pressure is extremely high, that's the bottom figure that is over 110, we put them to sit down for a while. And if it's still over 100, we might put off the visit also. But generally, the blood pressure, even though it's a little elevated, doesn't matter, And then we would explain to them what would be, what the procedure is going to be like, how the vaccination process is going to take place, and what are the potential adverse effects.
Preliminary investigations into the COVID-19 outbreak at the Mental Health Rehabilitation Center have been completed. So says Minister of Health, Wellness and the Environment, Sinclair Jimmy Prince, after being asked by opposition leader Dr. Godwin Friday for an update on the situation. The health minister said investigations reveal that the outbreak had nothing to do with shortcomings at the institution.
Madam Speaker, consistent with the aforesaid, we have formed the preliminary opinion that the outbreak is unrelated in general to any specific set of prevailing conditions at the center. Notwithstanding, we still continue to enhance our protocols and management systems to mitigate and forestall possible similar episodes in the future. However, based on the final results of the ongoing investigation, we will determine if there were any cases that have to be addressed to forestall similar episodes in the future.
Minister Prince noted that some patients at the institution move in and out of the facility, which they have no control, and that currently more than 90 persons at the facility are COVID-19 positive. He said some patients and staff have also been vaccinated.
In addition to patients, 10 staff of the MHRC tested positive and are all in quarantine. We have also vaccinated, based on voluntary consent, 89 patients of the MHRC and 15 staff members of the same center. Currently, there are 96 patients at the temporary isolation site at Queens Drive and a census of 90 at the MHRC at Glen. We have therefore already examined and investigated the outbreak of the COVID-19 at the Mental Health Rehabilitation Center, and we have responded. We know that these types of events are possible in circumstances where there is nationwide community spread of an infectious disease that has caused the global pandemic, notwithstanding the best efforts of our ministry to prevent them at its facilities.
St. Vincent and the Grenadines on Saturday, March 13, 2021, recorded its 9th COVID-19 death. A release from the National Emergency Management Organization, NEMO, said the latest victim is a 63-year-old female resident of the Mental Health Rehabilitation Center. NEMO said the diabetic patient with chronic psychiatric condition tested positive for COVID-19 on February 27, 2021 and was transferred to the temporary isolation facility. It was further noted that on March 8th, the patient was admitted to the Milton Cato Memorial Hospital COVID-19 ward, with COVID-19 pneumonia and uncontrolled diabetes and became progressively worse, requiring ventilation on March 10th and died on Saturday, March 13th at 7:50 p.m. from respiratory failure. Meanwhile, for the holiday weekend period, the country recorded 7 new COVID-19 cases. 6 of these cases were recorded on Friday, none on Saturday, 1 on Sunday, and none on Monday. 543 cases remain active with 1,129 recoveries. 1,681 cases of COVID-19 have been reported in St. Vincent and the Grenadines since March 2020. The public is urged to use a mask, sanitize, physically distance, and get vaccinated to reduce the spread of COVID-19 here in SVG. In other news, several government officials, including the Governor General, on National Heroes Day, observed on Sunday, March 14, 2021, took the opportunity to lay wreaths at the obelisk here at Dorchester Hill at the annual wreath-laying ceremony, which was scaled down this year due to the COVID-19 pandemic and the protocols in place which limit outdoor gatherings to 20 persons. Several cultural groups also made presentation at the ceremony, including the Resistance Heartbeat Drummers and the Renaissance Dance Company. Addressing the small gathering, Prime Minister Dr. Ralph Gonsalves focused on the history of SVG's lone national hero, Joseph Chatouillet, and the Garifuna people. He also spoke on the challenges faced by nature and public health and how they were dealt with in the past.
And we have dealt with them in a scientific manner, very sensibly, very maturely, very practically. We have dealt with them together, in unison, guided by science, not propaganda, nor hysteria. In the 1950s, after the abolition, the formal abolition of slavery in 1838. And after the subduing of the Kalinago and Garifuna nation by the British. And after the introduction into this country between 1845 and 1850 of indentured servants from Madeira, the public health situation in the country was terrible. And it gave rise to a national outbreak.
Minister of Tourism Carlos James, who also addressed the gathering, said that while Vincentians continue to celebrate the Garifuna hero Joseph Chatouillet, not many persons are familiar with the Garifuna language. He said more needs to be done to support the retrieval and preservation of the Garifuna history and culture.
We must move more swiftly to streamline Garifuna material and other local history in our schools. And we must applaud the teachers and the Ministry of Education who have been finding creative ways to do that over the years. We have to continue our support for the Garifuna Heritage Foundation and their Garifuna Research Center. We must continue to connect with the Garifuna communities in the diaspora on projects such as Vinci Homecoming and other initiatives to facilitate cultural retrieval.
Minister James noted that work will continue this year to further develop the Chatouillet National Park.
Commit over 100,000 to commission research and production of literature on the history of St. Vincent and the Grenadines. The Ministry of Education will also continue to work closely with the Garifuna Heritage Foundation to establish the framework for the formal introduction of the teaching of the Garifuna language in schools. This effort continues, and I'm certain all of us will accept that it is something that we must commit ourselves to, that our children and our grandchildren must remember the old Zirome, must remember not only Chatouillet as a national hero, but the history and the culture of our Garifuna people.
In his remarks, representative of the Garifuna Foundation, Marlon Joseph, said significant number of intentions are now proudly acknowledging the work of their ancestors.
Therefore, the examination of the past may require an examination of the national conscience and the reliving of the cost and quality of the survival of the indigenous population who remained in St. Vincent post-1797. The ongoing project to write a history of St. Vincent and the Grenadines will do much to provide information, but to also provoke a national debate and provide the nation with an opportunity to examine, analyze, and confront its relationship with its indigenous people.
The Ministry of Health, Wellness and the Environment from March 8 to March 14th commemorate World Salt Awareness Week under the theme More Flavor, Less Salt. Speaking on the ministry's Facebook page, Minister of Health, Wellness and the Environment, Sinclair Jimmy Prince, said that every year to promote good nutrition and healthy eating, the ministry in collaboration with the Pan American Health Organization joins a global community effort in sharing technical tools to develop and implement comprehensive policies for salt reduction and key messages to promote healthy practices at home, schools, and in the workplace.
Reducing dietary salt is recommended by the recent United Nations Summit to prevent non-communicable diseases and the World Health Organization to improve population health. Excess dietary salt increases blood pressure, causing approximately 30% of hypertension, and is a probable pro-carcinogen for gastric cancer, and is also associated with kidney stones and osteoporosis. The maximum quantity of salt recommended by WHO is 5 grams or 1 teaspoon per day. Persons of African descent are particularly susceptible to adverse blood pressure effects of excess salt. High levels of blood pressure is a contributory factor in at least 40% of all heart diseases and stroke cases, which represent 45% of NCDs. Hypertension is a major health risk in the Americas, where between 20 to 35% of adult population has elevated blood pressure. In Latin America and the Caribbean, these rates are among the highest in the world.
Minister Prince encourages persons to follow the World Health Organization, the WHO's recommendation of salt intake, noting that adults should consume less than 5 grams or 1 teaspoon of salt each day.
The COVID-19 global pandemic has changed our lives in many ways, including how we eat. Restrictions put in place to help slow the spread of the virus have meant that rather than socializing and eating in restaurants, cafes, and outdoor markets, we are now forced to spend more time at home. This, for many, could be the perfect opportunity to get creative in the kitchen with new recipes and flavors. While doing this, it is imperative to adhere to WHO FAO recommended salt intake of less than 1 teaspoon per day, which is equivalent to 2,000 milligrams of sodium. This Salt Awareness Week helps us to celebrate home cooking, the meals that shape our culture and society, the meals we grew up with, and the recipes we have tried and loved, all with more flavor, less salt.
And SVG joins the rest of the world on Monday, March 15, 2021 in celebrating World Consumer Rights Day under the theme Tackling Plastic Pollution. In an address to mark the occasion, Minister of Consumer Affairs Frederick Stevenson said that a recent study pointed to a global plastic pollution crisis, which he said should be a major concern for all Vincentians.
Plastics has become unsustainable and are a threat to our already fragile environment. Currently, we are facing a global plastic pollution crisis, which is further compounded by health and economic crises. According to the Consumer International, a global body that advocates for consumer rights, reference a report from the Pew Charitable Trust and Systemic Breaking the Plastic Wave of August 2020 calculates that the flow of plastic material into the ocean will triple by 2040 if major innovations and changes in policy and behavior do not occur. The report also estimates that by 2050, there will be more plastics in the ocean than fish.
Minister Stevenson said that now is the opportune time to highlight and address plastic pollution, especially as the COVID-19 pandemic added to the rise of single-use plastic, including gloves and masks. He also highlighted measures which the government has put in place in the frontal fight against plastic pollution, while urging Vincentians to do their part to tackle pollution.